continual discussions, methods of introducing change according to Coulter and Schlesinger. So we have negotiations and agreements. So during the changes or during the transition period, there will be negotiations and agreement that will happen between the new management and then the employees. Okay, manipulation and co-optations. So co-optations meaning the managements will add members, no, to the group of administration, for examples, or they have to select a member, okay, or select members to the new group, okay, or mga baka naman ng co-optations, they have to select a group of people into a new set of organizations inside the company. So again, and we have explicit and implicit coercion. When saying explicit, there is what we call a transition or change. During a change that happens during the transition period, it should be clear to the employees. So ganun klaro siya masyado. And then explicit coercion, it is the conversion of one type to another type, okay, or one management to another management. So that is explicit coercion. So there will be clear changes that will happen in from the old management to the new management. This happens usually during the transition period. Next, how to make change in permanent. Use of group of forces. So remember the controllable forces, and then you have the uncontrollable forces or the external forces, and then we have the internal forces, diba? The human resource, yung mga technology, everything. Use of leadership. So that is the new management or the new leadership will use its leadership power. Shared rewards, working with unions, concern for employees. Next, change is constant in pharmacy. Okay, for decades, the focus of pharmacy changed from dispensing to patient counseling. Okay, usually these are the changes until now. We are working more on patient counseling. Pharmacists discuss with the patients the proper medication selection, monitor therapy effect, drug related outcome, and make medication adjustment. Okay, so usually pharmacists today, we have to discuss not only the interpretations but also selection and monitoring of therapeutic effect in the Philippines, but in other countries it is already been part of the practice of pharmacy. But today in the Philippines, especially in community pharmacy, it needs some innovations and changes in the practice. Pharmacists today involved in software, system design, pharmacogenomics, and clinical trials administration. Yes, there are a lot of changes today in the practice of pharmacy. Software and system design of designing a drug. Okay, especially we have the term as computational chemistry, designing the structure of a drug. Not the structure, designing the what we call this one, especially designing, I mean the structure of a drug,